Let's tell us a little bit about your story. Why did you decide to get into oncology?
I didn't decide to get into oncology. In fact, I really tried to avoid it. I was a fourth-year medical student when my dad was diagnosed with cancer.
Oh, wow.
And he had a glioblastoma, which is still a fatal disease. And so during my internship in medicine, he was sick pretty much that whole time, and he died at the end of my internship.
Oh, wow.
And I was pretty badly affected by that. He was hospitalized at the place I was doing my, things, and so I was pretty much off on cancer. And in fact, I would trade as a resident and as an intern cases. So if somebody came into the hospital, they were a cancer patient, and they were assigned to me that day, I would trade it for 2 cardiology hits.
Really?
And that was a good deal.
Yeah.
That was a really good deal for the other guy. You do 2 admissions for my 1.
That's a nice
And
trade.
the chief of medicine got wind that I was doing that, called me into his office, and basically said, this is back in a pretty cruel era of when you were residents and stuff, all those old war stories. And he said, look, we can't have that. He said, you're going to have to get over this. And I was like, okay. And I said, it was rough. He goes, I know your dad. I know what you went through. He goes, but you're going to come off the wards for a while. And I said, okay, good. And he goes, you're going to go do oncology for the next 3 months.
Next 3 months?
And he made me go work on the cancer wards and outpatient oncology for 3 months.
Really?
At a time when it was pretty traumatic. And it was not a fun time for me.
How did you get through that? You just lost your dad and...
Because you had to. It was that or, I was going to be done. And so did it. And at that point, I thought I was going to be a cardiologist. And went and did my, rotations and everything, and then realized I really didn't want to be a cardiologist. But to, put food on the table and things, I also did a lot of moonlighting as an ER doc and urgent care doc. So I didn't know what I wanted to be. I decided I'd be an ER doc. And in fact, I probably the only ATLS certified oncologist out there. I was a helicopter guy.
Really?
Yep. And that was not very fulfilling. You don't really connect with the patients, and it's really algorithms. If you come in with this complaint, do this. You didn't get to know them. You didn't know the name of their dog or anything like that. And I was still sort of lost, and the one person who was unbelievably kind to me was the oncologist I worked with for those 3 months.
Really?
Woman doctor, she was wonderful, Marcia Liepman. She was probably one of the first of the community oncologists, actually, because she drove out to Western Massachusetts. I was at UMass. She drove out to Western Massachusetts and would hold clinics in little remote hospitals. Long before that was a thing. There was no such thing as community oncology. And I loved her. And I went and sought her out, and I said, I'm sort of lost. I'm not sure what to do. And she said, well, your problem wasn't oncology. You just hated cancer. She said, and I said, well, do you think I'd be a good oncologist? She said, yeah, you'd be a very good oncologist. And I said, so what do you want to do? I said, so she goes, well, you should do a fellowship.
Yes.
And I said, I've been thinking about it, and I was going to go into Boston, Dana-Farber, and things. And she goes, no, you got to get out of Massachusetts. I was too inbred. I had gone to college there, medical school there, residency there. I said, leave. I said, where do you go? She said, Michigan.
Wow.
I said, why? That's where she went.
That's where she went.
I never applied. She just made a phone call, and I trusted her enough to just say, okay, I'm going to get in a car and go to Michigan, and that's where I did my fellowship.
Wow. Well, that's
how I ended up in oncology. And she was right. I still hate cancer.
Yes.
And I still get negatively affected sometimes by things that happen.
Wow.
But I'm very satisfied with the career choice.